Niraparib, sold under the brand name Zejula, is a medication used to treat ovarian, fallopian tube, or primary peritoneal cancer. It works by slowing the growth of cancer cells. The usual dose of Zejula is 300 milligrams taken by mouth once a day. It can be taken with or without food. It is important to take Zejula at the same time every day. Before you start taking Zejula 100 megagrams capsule Antineoplastic-Poly, Adp-Ribose, Polymerase, Parp, inhibitor, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Taking this medication at bedtime may help to reduce nausea. Swallow this medication whole. Do not chew, crush, or split the medication. The dosage is based on your medical condition and response to treatment. If you vomit after taking a dose, do not take another dose at that time. Take your next dose at the regular time. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of serious side effects will increase. Some common side effects of Zejula 100 mg capsule include nausea, vomiting, loss of appetite, constipation, bad taste in your mouth, dry mouth, mouth sores, dizziness, headache, or trouble sleeping. If you experience severe nausea and vomiting, taking this medication at bedtime may help reduce nausea. Your doctor may also prescribe medication to prevent or relieve these side effects. Eating several small meals or limiting activity may also help lessen nausea and vomiting. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to be aware of the potential serious side effects of this medication, including a decrease in bone marrow function, which can lead to a low number of blood cells, anemia, decreased ability to fight infection, or easy bruising/bleeding. Your doctor will monitor your blood cell count, and it's crucial to report any symptoms of anemia, infection, or unusual bruising/bleeding to your doctor right away. Additionally, Niraparib may cause a condition called PRES, posterior reversible encephalopathy syndrome, so seek medical help if you experience a persistent headache, seizures, sudden vision changes, or mental/mood changes. This medication may also elevate your blood pressure and heart rate, which can be serious in some cases. It's essential to regularly check your blood pressure and heart rate and inform your doctor if the results are high. Your doctor may prescribe medication to control your blood pressure and heart rate. In rare cases, a serious allergic reaction to this medication may occur. If you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed here, contact your doctor or pharmacist. If you experience any side effects, it's important to consult your doctor for medical advice. You may also report side effects to the appropriate regulatory agency in your country. Before starting Zejula, make sure to inform your healthcare provider if you have any allergies or if you have a history of certain medical conditions such as heart disease, high blood pressure, or liver disease. Zejula may increase your risk of getting infections or make existing infections worse. It is important to avoid contact with individuals who have contagious infections, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to consult your doctor for further guidance. Notify your healthcare professional before receiving any vaccinations while using Zejula. It is also recommended to avoid close contact with individuals who have recently received live vaccines, such as the flu vaccine that is inhaled through the nose. To reduce the risk of injury, be cautious when handling sharp objects and avoid activities that may result in cuts or bruises, such as contact sports. Zejula may cause dizziness. It is advised to refrain from consuming alcohol or marijuana, as it can intensify this effect. Until you are certain that you can do so safely, avoid driving, operating machinery, or engaging in activities that require alertness. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the medications, including prescription and non-prescription drugs, as well as herbal products, that you are using. If you are pregnant or planning to become pregnant, it is important to discuss this with your doctor before starting Zejula. It is crucial to use reliable forms of birth control while taking this medication and for 6 months after the last dose. If you become pregnant while using Zejula, consult your healthcare provider immediately to weigh the risks and benefits of continuing the medication. It is not known whether Zejula passes into breast milk, and therefore, breastfeeding is not recommended while using this medication and for 1 month after the last dose. Be sure to consult your doctor before breastfeeding. When taking Zejula 100 mg capsule, it's important to be aware of potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Zejula 100 mg capsule. Always consult with your healthcare provider for personalized guidance. If someone has taken too much Zejula and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. It's important not to share Zejula with others. While taking this medication, it's crucial to have regular lab and medical tests to monitor your health, including complete blood count, blood pressure, heart rate, and kidney/liver function. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget a dose, just skip the missed one and take the next dose at your regular time. It's important not to take double the dose to make up for the missed one. When storing Zejula 100 mg capsule Antineoplastic-Poly, Adp-Ribose, Polymerase, Parp, inhibitor, make sure to keep it at room temperature and away from light and moisture. It's important to store the tablets in the original bottle and to keep all medications out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.